Okay, I'm going to start another 15-minute segment. Let me just get the timer started here. So I want to make sure I mention the idea of, these measurements. We have talked about this before in special education care and treatment, if you will, for kids with special needs. But always, it's important in this measuring to demonstrate gains that there's the baseline measurement, which is, some of you probably, I'm sure you all know about this, but just that at the very beginning, before any intervention is offered, a child is assessed and given baseline scores so that we know from where we started with this child. And so I want to make sure that I mentioned that too. Well, I also want to start with how important is it to provide this early intervention for infants all the way up really through where a child might go to kindergarten. That's really what we're talking about. So remember, we're talking about birth through 2 years old as kind of a service category area, and then age 3 through 5 as another category of service. And I might just go ahead and say right now that there are two pots of funding actually that happen, and two kinds of sort of service agencies that provide this intervention for children. So the birth through 2 years is administered in every state by a very specific agency that offers this early intervention service to families. And so in North Carolina, this is called the CDSA, Child Development Services Administration. And actually our office for the CDSA in Moore County is in Pinehurst, right over by number 5. And I actually have had a couple of students who've done internships there who were very interested in early childhood care and intervention. And so this organization receives a pot of money, if you will, federal funds to run this program for kids birth through 2 years old. And it's it's certainly an agency where experts come to a parent's home and they provide screenings and get baseline measurements and then develop service plans for the kind of intervention these little tiny people need. So often these young babies are going to need physical therapy, they might need speech therapy, they're going to need other kinds of interventions that help them with the development of interaction, and it depends very much on the kind of disability that the child has. Also, this agency comes to the family's home. And so if you were an expert working in this field, which would be like a bachelor's level special education specialist, maybe somebody with a master's degree, you would travel to, you'd have a caseload of certain families, and you would travel to their home, at different regularities, at first just for screening, but then to go to meet with the parents and explain what needs to be done, what's offered, and then actually providing services and also kind of brokering services by bringing in a physical therapist or bringing in a speech therapist or an occupational therapist. Excuse me. And so that's sort of how this service provision happens for the very earliest children, birth through 2 years of age. And then from 2 to 5 years of age, this service provision happens under the IDEA law, which is responsible for providing, special education preschool for these children. And so, all children in the United States in all states, receive funds to provide preschool that has special education as its goal. And so that's through IDEA funds. I think I'm explaining that pretty well in terms of the structure of how these kids, how service gets paid for and who does this service and so on. So I want to talk with you a little bit about screening. How do we screen these infants and toddlers? How do we find out so early in life that these little babies and infants need special stimulation and therapy, and that they are probably going to need some help with their developmental delays. Well, the very first screening that every child in America receives, you already know about, which is the APGAR test. It's described in pretty good detail in your chapter. It's kind of around page 476. And what the APGAR score gives every brand new parent, is a scale that lets us know how healthy our baby is at birth. And this is very much related to the degree of oxygen deprivation that a child has experienced during the birthing process. And every child experiences some stress during birthing. And so this APGAR test is meant to measure the ways in which a brand new infant is under stress. And you probably know that a high APGAR score shows that the infant has high health and high oxygenation, and lower APGAR scores indicate that a child needs some help immediately, maybe with oxygen, or that they have other kinds of needs. So the APGAR test is the first screening tool that might suggest and show that a child is going to need some help, or might be at risk, let's put it that way. Also, in terms of immediate screening at birth, nurses are highly trained to recognize symptoms like a child who might have Down syndrome, or a child, certainly as they inspect a child and their hands and toes and appendages and so on, recognizing that a little one has a cleft palate is another kind of screening that would be noted right immediately at birth. Also, an undersized brain, or as it's referred to in the textbook, microcephaly, would be another one of those evidences that a child has some kind of almost like we would say a birth defect, right? Then there are blood screening tests that all states in the United States are required to do, and one of the most well-known, I guess, diseases that a child can be detected to have at birth through blood screening is PKU, or phenylketonuria. And this is a type of condition, really, digestive condition, where a child, an infant, is unable to digest proteins, certain proteins, and it can actually cause the child to have extreme intellectual disability if it's not noticed and treated right away, just really through diet. It's just something that can absolutely be addressed through the baby's diet, but must be screened for, and that's a blood screening test. And then there are two other widely used developmental screening tests that start to be used when we take our babies for well baby visits at the pediatrician's office. And so all of these screening tests that I'm referring to are the ones that I guess I want to refer to now that would be done at well baby visits, have to do with noticing some very specific areas of need or development. And hold on, let me find that in my notes. Kind of maybe got ahead of myself here. Well, let me just talk about them off the top of my head. I somehow can't find them in my notes just this moment. So these developmental tests that are given at well baby visits are shuffling around here, hold on. Have to do with, as I mentioned to you before, gross motor development, noticing that, fine motor development, language development for infants, adaptability or adaptive skills development. So this could be things like ambulating around, or using the fine motor muscles to pick up something, to put into their mouth. Also social and emotional development. How much is this child interacting? And so these kinds of screening tests are given to children, as I said before, at their well baby visits. Oh, here it is in my notes on page 7. I think I really did get ahead of myself here. The first one is called the Denver 2 test, and it's just one of the tests that's offered, and that your pediatrician actually does by asking you questions about, is your child doing this? Can your child do that? Are you noticing your child, interacting in this way? And then the other one that is offered and done is called the Ages and Stages Questionnaire, and this is based on parent report. Both of these tests, actually screening tests at well baby visits, are based on what the parent reports as the health professional is questioning them about their child's development. These start at age 2 months and then are given and repeated at 2-month intervals. So at 2 months, 4 months, 6 months, 8 months, 12 months, all the way up until 48 months. So each time a parent takes their baby to a well baby visit, part of what's happening there is screening for development and then looking for ways sometimes where a child might not be meeting developmental milestones. And so I hope this is helping you understand, how screening is done, why screening is done, and really how important it is that the parent be given, the parent is one of the most important persons in this process because of their exposure and constant being around little ones. I want to point out to you that, I somehow got jumbled up, but I want to point out to you in my notes that children who are receiving special care, special education services in the early years of life have a special plan that's created, an education plan that's created for them. This is where I kind of got waylaid in my notes. And so it's like an IEP, an individualized educational program, but it is called an ISFP, an individualized family service plan. And so I think it's really notable that the word family is in this, in the name of this document. It is just like an IEP, but it's has the family and the parents really as a central focus, because the parents are the ones, like I keep saying, who are going to be the most involved with the child's development and stimulation, really, at home. So this is described on page 471 and 472, and the ISFP must include 8 different elements of stimulation and care and intervention. And those, I think, are described, I'm not going to give you notes on that, but those are described on pages 471 and 472. And there's even a sample of one of these plans for a child named Kathy, and it's kind of a great thing to take a look at. It's on pages 473 and 474, and so I would direct you to look at this ISFP. The sample that they're giving to us in the textbook has 2 main outcomes that are listed that the parents state are important to them, and then you can see that there's quite a bit of detail in terms of how these outcomes are going to be met and who's going to be responsible for making these things happen, how often the service is going to be provided, even whether this is going to be provided on an individual basis or as a group basis, and so on. And this ISFP for these young infants, birth to age 2, must be reviewed, of course, once a year, but every 6 months it has to be it's required to be reviewed with the parents. And it really recognizes that the home environment is the main site of intervention. So as I mentioned to you earlier, intervention is almost always going to happen in this birth to age 2. This intervention is almost always going to be happening at home, perhaps sometimes in a hospital setting, or perhaps sometimes in a very specialized daycare center where special education services are provided. But really, in practicality, almost always this kind of service is going to be happening in a child's home. And so the ISFP really focuses in on that this is where it's going to happen. And there's a special emphasis on including the parents and helping parents understand, why are we doing this for your little baby on a tiny little blanket on the floor? Why am I moving your baby's legs this way? Why am I holding your child's hands this way? Why am I helping your child reach out and grasp and ambulate towards toys this way? Why am I trying to engage your child in social interaction with eye contact? All of these kinds of therapeutic interventions that are done with infants through age 2, it's very important that the parent understands why, and also kind of how to do it themselves, so that they can continue to stimulate their child at home even after the therapist leaves and goes on to see another family. Okay, I think I'll stop there and then pick up for a second lecture with you in another segment.